now. Everywhere.
Yes, right from your Android or iPhone. Download the Radio K-Man app now on your Android or iOS phone.
The Radio K-Man app
is where you can listen to Radio K-Man everywhere you go.
Everywhere we go, we go. Everywhere we go, we go.
Find it in the Google Store, the Apple Store, or use the link at www.radiokman.gov.ky.
Yes, now you can listen to Radio K-Man everywhere.
Talk Today is brought to you by the Ministry of District Administration. Explore your history. Explore your land. Explore your sister islands. And Doctors Hospital. Peace of mind is important when life happens. Doctors Hospital. Always there for you. Call 949-6066.
But I do have some questions.
There are more questions than answers.
Cayman Islands' foremost listener participation program.
Talk Today.
What's on your mind, K-Man? If you're ready to talk, we are ready to listen. Discussing current events and local news, community spotlights, hot topics, listener stories, cultural and historical discussions, environmental issues, fun and lighthearted topics, guest interviews. K-Man, basically anything you want to talk about, we are ready to listen. Here's your guest host, Charles Glidden.
Coming up next, we hear how to get a free health check this weekend, and later, how you can give your opinion about service at HSA facilities. And later, it's open line when you can voice your opinion on just about anything. Talk Today, next on Radio K-Man. Stay with me.
Talk Today is reminding you
to avoid any statements or comments which are abusive, derogatory, malicious, or defamatory. Do not use indecent language or make any statement that is false or misleading. Call 1-800-534-8255, 949-6990, 949-8037, or WhatsApp us on 925-3261.
And now, back to Talk Today.
Good afternoon and welcome to Talk Today. I'm Charles Glidden. Thank you for tuning in. I hope your day has been, smooth sailing and continues to be throughout the day. Well, the whole world has its eyes on the Middle East, and I guess that goes for us here in Cayman also. That's, the U.S.-Israeli conflict with Iran has gone wider than those three countries now, and the international economic impacts are starting to develop because of that. You all know oil is at at the center of everything, right? And they got a lot of it over there, and also you got the ships that bring it out of there are being impacted. Only a trickle of ships are coming out through the Strait of Hormuz right now. And that is, of course, the gateway for a fifth of the world's oil supply. And oil's already gone up. And just yesterday, the premier was in here, and we were talking about the cost of living, and he was saying how if we can cut energy costs here in Cayman, that could, have a ripple effect and cut costs of living expenses in, different areas, because everything is driven by energy, whether it's oil, electricity, what's happening at the gas pump, how much we individually have to pay for fuel to get around. But we have to kind of wait and see here, because from what I was seeing on BBC last night, the consensus was just how far-reaching this economic impact will be internationally really depends on how long this goes on. If it's a relatively short conflict, well, might have a spike and then it goes away. But if it lasts, in a protracted manner, it could have a lot of impact. And President Trump has told Americans it would be the war would last about 4 to 5 weeks. Well, you know when you start a war, but when you end it, that's like a whole different story. Because after it starts, it's kind of got a life of its own, and things happen that you didn't intend to. So watch the gas pumps. They will tell the story of the price of fuel. I checked the Off-Reg website, and right now, according to Off-Reg, you can buy regular gas at a full-service pump at Brown's Red Bay for $4.94. That was the lowest price I saw on there as far as full service, $4.94. But most places are, around $5, give or take a few cents. So if you roll up to the gas pump and you see it gone up $5.50 or something, you know it's happening. And we'll just have to wait and see. Well, this weekend, you can get a free health check. That is courtesy of the Rotary Club Central. And here to tell us all about that are Jamela Badu. She is the Health Project Chairperson with Rotary Central. And the President of Rotary Central, Steve Tibbetts, is also here in the studio. Folks, good afternoon. Welcome.
Good afternoon. Thank you.
I know you come on in here quite often, but this is the first time in the new studio, right?
It's looking really swish.
Very nice.
So, how long has Rotary Central been doing this now?
Well, this is our 14th year of.
Just put that mic a little bit closer in front of you.
This is our 14th year of doing the health screenings here on island, and. As I was saying earlier, we run 2 each year. The mini event is in November, and the major event, which is what we're here to talk about this afternoon, is coming up in a few days' time, this coming Saturday.
So this event is more widespread?
Yes, it is. We are going to be at 5 different locations across the island this weekend. Going to be at Costules, A.L. Thompson's, Foster's Airport, Savannah United Church, and the Eastern Health Centre. So we're trying to get as broad a spread as we can across the island this time.
Jamela, what does it take to put this together?
It's a lot of work, but it is work that we love to do. We've been doing this since 2010, and it is really fulfilling when we can help the community in this way. And it takes a lot of help from others as well, because we have a lot of volunteers, medical professionals who assist us with this project.
So this is all going to happen on one day?
All in one day.
Yeah, so it must be a task to, marshal all these people together on that one day with the professionals, like you say.
It is.
Their own commitments.
It is, and we're really grateful for those who come out to partake in this event, because it really is taking almost an entire day for this event. So we want everyone to come out so that they can get their free health screens and make it more meaningful.
What is involved in the screening?
All right. It's a series of tests that the patients will undergo. Most of it is through a single finger prick test, a blood test. But we start with a body mass assessment. We'll do your BSA, or your body surface area. We'll do your weight, your height to get that. You'll also have your blood pressure done. Your blood sugar will be recorded as well, including the current, your random blood sugar test, meaning what's the value now, as well as the glycosylated hemoglobin test, otherwise called the HbA1c, which gives us the average over the past 90 days, as well as your hemoglobin levels. You get to know what level of iron is in your blood, and also your lipids, which would be your cholesterol. We will tell you how much of the good cholesterol versus the bad cholesterol that you have.
So there'll be a consultation after
Yes. Once you've received your results, then you can also get medical consultation from a pharmacist if you want to discuss medications which you may already be taking, or the benefit of adding medications, usually over-the-counter items or prescription items, to your regimen. And there will be a registered physician on site. If your values are out of range or anything unusual, you'll be able to see a physician on site. You don't have to go to the doctor's office, and then they will be able to advise you further.
So if you intend to get this and take advantage of it, you don't have to worry about what you eat that morning or anything like that?
No, there is no need to fast. All the tests that we're doing do not require you to fast. Please just come as you are, and we will test you right then and there.
We're going to hit the pause button right here and take a little break, but we'll be right back.
Wouldn't it have been grand if you had purchased land 30 years ago? It may not be 2020, but a perfect vision has never been more clear. Cayman Brack and Little Cayman, poised for growth with an eye on the future. Your land, your history, your future. Discover all that our sister islands have to offer.
By now, you should know that the use of tobacco and alcohol are determinants of ill health, meaning that they negatively influence health outcomes for users. Yet 13% of Cayman's population are current smokers, and 9.9% of the population drink daily.
The STEPS 2023 National Health Survey gives us information on the prevalence of risk factors for non-communicable diseases. Your health matters. Let's step into Wellness Cayman. Learn more by logging on to gov.ky/steps.
Healthcare Pharmacy, caring about your health for the past 25 years. Radio Cayman's premier health show.
Alzheimer's and dementia, are they the same disorder?
Yeah, I think that's a very important question.
For the Health of It with Tara Bush.
For the Health of It with Tara Bush.
Is heard on Saturdays at 9:30 a.m. and on Wednesdays at 7 p.m. Brought to you by Healthcare Pharmacy in Grand Harbor, where they care about your health. Transfer and refill your prescription online. Visit healthcarepharmacy.ky or call 947-8900. Healthcare Pharmacy, now with a second location in Governor's Square. Healthcare Pharmacy, where they care about your health.
The Consumer Price Index Rental Survey conducted by the Economics and Statistics Office is now underway. The survey aims to collect data from residents of the Cayman Islands who are renting properties. The ESO invites participation in the Consumer Price Index Housing Rental Survey, which the ESO will conduct in February, May, August, and November each year. The CPI survey helps to calculate the inflation rate or the changes in the cost of living in the Cayman Islands. Trained ESO staff with ESO ID cards will administer the survey. The individual information is confidential in accordance with the Statistics Act. No individual data will be published or disclosed. Survey data are exempt from Freedom of Information requests. For more details, please call the ESO hotline at 516-3329 or directly at 244-4602.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back, and we're hearing about the Rotary Club Central's health check that is taking place this weekend. So it's on Saturday. This is
yes, it's on Saturday, starting at 10 a.m. and we go up until 2.
You have any stats, Steve, as how many people have been helped over the 14 years, 13 years?
Well, over the 14 years, I mean, it's been accumulative, and the numbers that we have been able to reach out and help have steadily increased, which is encouraging from our point of view, because this is a free resource. So we can't say enough, strongly enough, to come and get checked out. But just to put things into perspective, on the mini event that we ran in November, we saw 154 participants across the 3 sites. And from that, there were a number of interesting statistics that came out. More than a third of the people that came out indicated uncontrolled diabetes.
Uncontrolled?
Uncontrolled. So that's quite a high number of people that didn't know they had an underlying condition. Nearly a quarter were in the pre-diabetic range, and not to get too wound up on numbers, 17% were already diabetic. So it highlighted an issue that had those people not have come for a free health check, it may have gone unchecked. So to us, it's encouraging that they come forward. It's encouraging that we were able to identify it, and then through the healthcare professionals on each of the locations to put them on a path to better wellness.
And diabetes, I mean, if you don't know that you have it, that can develop and get real bad on you quickly.
Yeah.
We do have a caller, so I'm going to ask you to put on your headphones there. Good afternoon. You're on the air with Talk Today. You have a question?
Yes, sir. Good afternoon, Charlo, and good afternoon to your guests from Rotary Central. One question is that do you all plan to, the many years you have done it, do you all plan to go to the BRAC as well? Because we're 3 islands.
I can answer that.
Okay, well, let's get an answer.
Okay, there is a Rotary Club on Cayman BRAC, and I know that they do have a health screen from time to time. We are trying to work with the club to have a united health screen there. So you can look forward to seeing that in the future. It's just a matter of working out, the little nuances to get it done. But we're coming.
All right.
Oh, okay. That
have not
should
been
answer
forgotten.
that.
Pardon?
That should answer that. But I would really like to see it done. Not from time to time. Every year.
Well, I think that's what she's saying. They're working on getting it on a regular schedule.
Okay. All right. Okay. Thanks very much for your answers.
All right. Thank you for calling.
Thank you.
So
Okay.
you would try and do that as a sort of a national thing then, that it's happening in Grand Cayman and in the BRAC at the same time as a big effort?
Yes, we don't want to leave anyone out. It's not cardiovascular diseases and diabetes is not exclusive to Grand Cayman. Residents in Little Cayman and Cayman BRAC do need to be screened as well and be screened regularly. So we have recognized that deficiency, and we're trying to work with the club on the BRAC to have our screen there as well regularly.
The fact that so many people didn't know that they were diabetic, does that mean they're not getting checked at all? I mean, they're not going, get every couple of years that they go and get a physical, get checked up?
I don't really know if that's the answer. All I can say is that there are many people who are reluctant to go forward at all for any kind of check. And when you consider that every time that you sit down on a chair in a doctor's office, somebody has to pay something. Mm-hmm. That's an off-putting aspect for a lot of people. So the fact that we're offering this as a free resource to anybody who wants to come and speak with us is encouraging, because they're taking opportunity of that. So we're just doing what we can to try and fill a void in the system.
Well, interesting that you would bring up cost being a barrier for some people, despite the fact that supposedly everybody has insurance in Cayman. But I mean, I've heard from a number of charitable organizations, as they go around doing their service, they discover a sizable number in the population that, especially elderly, that can't even afford the insurance.
Yeah, and again, I don't have much that I can say on that specifically. But one of the other aspects that we can talk about as well is accessibility. So part of the reason that we are spreading the net as far as we can, including East End this time, is that in the past there have been a number of people in the East End that haven't been able to make it to the closest place before that would have been Savannah. So by going out to the far reaches of East End, so to speak, then we're trying to make the service available more often. Example, even in November, we had a number of older people from East End that came into the health centre, and the oldest one was 91 years old. So they're taking advantage of, and by the way, that guy was actually as fit as a fiddle.
Yeah.
There was but anyway, the point is he took advantage of what was on offer. So it was encouraging.
I mean, it sounds like people really do take advantage of it. They, the opportunity is there, and they take you up on it.
Yes, and we have persons who come year after year. It's one of the few occasions they get to get their health screened. There may be other limitations or other barriers.
Yeah.
For example, working hours. You don't have the time to go to the doctor as well. As he said, the location, we're spread right across the island. It's easy. If they're going shopping, they can just stop by and do a single finger prick. And there's also fear of the unknown. A lot of people don't want to get their self checked out because they don't want to know that something is going wrong.
Yeah.
But prevention is better than cure. It's better than and then we can also advise you on the steps to take to get better, which is most important. It prevents worse happening later on in life.
And it's amazing what that little bit of blood can tell.
A little drop.
Right? Yeah. And do you see any difference between men and women doing this?
Most definitely.
Most definitely, she says.
Yes. I think the men have the greater fear of the unknown. They just don't want to know. Also pain. They believe there's a lot of pain with the finger prick, but it's not. It's like a little pinch, and in 2 seconds it goes away.
But interestingly enough, there were slightly more ladies that came out at the November health screening than men.
Which is good. We're getting somewhere.
Indeed.
The men are coming out now.
Yeah. Does this require the whole club to get involved in this? I mean, all hands on deck?
We always put the call out to all hands on deck. It's quite resource heavy. So, as Jamelia mentioned earlier, we have the club members which are on each of the locations to do the non-clinical elements like taking the height, the weight, and measurements like that. But as soon as it requires clinical stuff like the pinprick and all the readings, etc., the clients are then passed on to medical professionals to do that one. So the next part in the chain is to have medical professionals on site, and they all give up their time. They're not paid to do this. They are coming out to support us in our overall mission to provide health checks, wellness to the community. So we cannot thank them enough for all of the time and resources that they donate themselves to do that. So we have a big team at each location. So I can't talk about just a global team, because each location has its own team of specialists to be able to deal with all the clients that come through the door. So it's exciting and very impressive.
Have any people, or even the people there at the station, been surprised at finding how bad off someone was?
We have had I think it was 2 red light cases or blue light cases in November where we called 911 immediately because someone's readings were so far in the wrong direction that it was they needed medical assistance immediately, and they had no idea that they were walking around in such a position.
Wow, that's amazing that you can be on the verge of going to the emergency room and you're completely unaware of that.
Mm-hmm.
Of course, they may have been avoiding it too, for all we know, right? From just what you're talking about, the fear of knowing.
The thing with cardiovascular diseases, sometimes they're silent killers. You'll be walking around feeling okay. Maybe you'll have an occasional headache. Or if you have diabetes, you find yourself urinating a lot more, but you don't think too much about it. And that's when it has already progressed too far. But that's what this health screen helps to do as well. It lets you know how healthy you are. If you feel you're in the pink of health, still come and get your check, because you just never know.
How have things changed over the 14 years you've been doing this?
I think the biggest change that we could identify is with the improvement in technology, we can be much more accurate and efficient at understanding the information that we're given.
So what was when you first started doing it? How did things go compared to now?
Well, I've only been doing this for 12 of the 14 years now. But
well, that's a heck of a portion of it.
Yeah, but I recall that the sensors and the indicators were nowhere near as elaborate. So you're having to wait for a drop of blood to be put onto a reader for it to think about it for a while, then come back. So we weren't, even though we didn't have the numbers of people that we have now, it was still taking considerably longer to get the same results or to get anywhere near the same results back in the day. So when you combine, the specialists that we have with the technology that we have today, we can be a lot more thorough and a lot quicker as well to get the information that they need.
So you can handle many more people than you could before.
Indeed.
Yeah. We have to take a little break here. But we'll be right back and hear more.
Did you know that Doctors Hospital provides urgent care services 24 hours a day, 7 days a week? And Doctors Hospital's urgent care physicians have access to the most advanced MRI and CT imaging in the Caribbean, providing reliable diagnostics when you need it most. When you need quality urgent care for an illness or injury, Doctors Hospital is here for you 24/7. Whether it's a migraine, chest or abdominal pain, shortness of breath, broken bones, or another urgent need, Doctors Hospital at the top of Walker's Road. Urgent care right now.
The offices of dermatologist Dr. Wayne Porter will be taking appointments from March 9 to 13 at his Crew Road Clinic. Appointment slots are limited. Whether you're seeking advanced skincare, Botox, filler, cosmetic enhancements, or simply looking to reduce wrinkles, Dr. Porter offers a full-service dermatology and dermatological surgery practice. For more information, email dr.porterkman@gmail.com or call 946-9020 to book your appointment today. That is 946-9020.
Ready to launch your career in hospitality?
If you're an ambitious young Caymanian, the DART Hospitality Training Program is your opportunity to shine.
This paid 4-month program gives you hands-on experience at world-class properties like Kimpton Seafire, the Ritz-Carlton, Hotel Indigo, Hampton by Hilton, and Bonnie Moon Beach Club.
Plus, DART has partnered with Lynn University to deliver an intensive 2-week hospitality curriculum from an accredited institution.
Gain real-world experience, learn from the industry leaders, and open doors to full-time careers in hospitality.
Applications close April 6, 2026, with programs starting May 2026.
Apply now at dart.ky/hospitality.
Hey man, this is DJ Lynn. Catch me live weekdays from 7 till 10 a.m. on the Morning Breeze, our sister station, Breeze 105.3 FM. We're waking you up with the best adult contemporary hits with the 70s, 80s, 90s, and much more. So start your morning the Cayman way with me, DJ Lynn, on the Morning Breeze.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back, and we're hearing about the Rotary Club Central's free health check that is going to be happening this Saturday at various points around Grand Cayman. And let's take a moment to talk about the blood bank bus that the club donated this bus.
Yes, last year what year are we in? 2025. We donated a bus to the blood bank at the Health Services Authority. This was to give them an opportunity to spread their wings and make themselves more accessible to Grand Cayman, residents of Grand Cayman who are willing to donate blood without having to beat the traffic or trying to find parking at HSA to go to them. So they're able to go out into the community. So that bus will actually be at the Savannah United Church health screen location on Saturday, same times, 10 to 2. And that gives persons an opportunity in the Eastern Districts especially to come out and give blood.
I don't know if you know about this, but is there certain restrictions on who can go?
The blood bank has a website that you can do a quick screen test to know if you qualify to do the test. We've all given blood before, or attempted to give blood before, and on the day on site, they will also ask you a few questions, and they'll do a preliminary blood test before you give.
Okay. Walk us through the procedure that will happen on Saturday.
On Saturday? Okay.
When a person comes up and says, I'd like a check.
All right. So once you come to us, you get registered at the first table. You sign a form, fill out all your details and sign the form. And then you'll proceed to have your height, your weight checked, your blood pressure and your blood sugar. Your blood pressure. And then you move on to the finger prick test, which is literally one prick, and we try to get as much blood as we can for the three tests that require the blood sample. After that, you will get an opportunity to speak to a pharmacist who can provide information, as I said earlier, on medication management. We'll assess you I'm a pharmacist as well, so I said we'll assess you to see if your medication may be having any positive or negative impact on the readings that we're seeing. And then if there's anything, any outlier, anything unusual, we'll refer you to the doctor. If there are any emergent cases, you will be immediately referred to the physician who will be there who will then further assess you. If needed, you be referred to the emergency room, which has happened before, including our last health screen, or you just receive some take-home advice.
Okay. We do have another caller. Good afternoon. You're on the air with Talk Today.
Yes, sir. Good afternoon, Charlo. I just wonder if someone have the diabetes already and the high blood pressure, do them?
Yeah. Hello? Are you there?
Yes.
Yeah.
Yes.
We kind of lost you at the end there. Could you just repeat that, please?
I'm just asking if someone have high blood pressure and they
diabetes?
Yes, sir. Is that person can come there too?
Yes, please do come. It is an opportunity for you to get an update on your status and also to speak to the physicians who are there to get a current assessment of where you are. Also, we will be providing free glucometers. That's the machine that tests your blood sugar. We will be providing free glucometers to patients who have diabetes, who may need a new machine, or who has just been diagnosed and need a machine. And this was donated by Caribbean Medical Distributors to our club, and we thank them for that. But yes, please do come out. You don't have to be healthy to come. Whether you're healthy or not, please come.
Yes, ma'am. I know this elderly. She is living in New Orleans beside us. She have those two things. And she have a blood machine not working. She get one the other day. I don't know where she get it, and she cannot set it up. And she asked me to see if I can do it, but I just come out of the hospital, so I can't help her. But I would get somebody to bring her. She also have a blood pressure machine, and it's not working.
Yes.
And she's elderly, so I don't know if she can bring it when she gets a right to come.
She can come. Let her bring the machines. The closest location would be the Savannah United Church. That's behind Chill Spot or Wendy's.
I know where.
Yes, you can come. Let her bring the machines. We'll check them. If they're not working, we can replace the blood sugar machine. We don't have blood pressure machines, but we can direct you to where you can get one. Well, direct her to where she can get one.
Okay, ma'am. Thank you very much.
All right.
You have a blessed day.
You too.
All right, Chalwa, you day. Bye-bye.
All right, thank you for calling. So that is very interesting. You actually give them so that they can test their blood themselves.
Right. We don't want you to... Our goal is better health. We don't want you to just know whether you're healthy or not, but we want you to take the necessary steps. And we start you off with a machine if we can. We start you off with the advice if we can. And those are the tools, some of the tools that you would need to ensure that we prevent you from getting worse too soon.
So you said that a physician will be there?
Yes.
Now, is it possible for a person to ask advice beyond that, the basic check that you're giving? Or?
The conversation with the physician and the patient is private, so we don't get involved in that part. That's between the physician and the patient.
Okay.
They have all right to ask what they want to the physician. The physician then will say what they can or cannot do, or recommend the patient to get further treatment elsewhere.
So people can rest assured that they can have a private conversation with the physician.
Yes.
That's very important.
Yeah, and I think it's also important to mention as well is that all data that's accumulated is confidential. So only the physicians or the medical professionals get access to the results and what it actually means. The Rotarians on site, we're just the ones that do the simple tests, height, weight, body mass, etc. So we don't get access to any of that one. So if people have any concerns about the doctor-patient confidentiality, please be reassured it is absolutely intact.
So let's run through the locations once again.
Yeah, so we are going to be operating at Cost You Less, A.L. Thompson, Foster's Airport, Savannah United Church, and the East End Health Centre. And if you have difficulty in finding anyone there, we do have a mascot at each location. We have a big, bubbly, red heart of a guy called Ticker. So just look for the heart.
And the heart will direct you in the right direction.
Yeah, right. Without saying
follow
the heart.
Follow
exactly.
the heart.
So North Side is not on there?
No, we want the North Side residents to go to the East End Health Centre.
Okay.
Yes, that's the closest location.
Just trying to do things as efficiently as possible, I guess.
Yes.
So, what general reception do you get from people, though? What kind of reactions do you get from people when you set up and are out there working?
It's all positive. In fact, while we're setting up, there are persons waiting on us to begin. It's one of the few.
Before you do.
They get there before we do, and they're anxious. They want to know. But again, the barriers are a big issue in getting to access to health care. So that's what we present to them. They're willing and ready to come.
And you get started when?
We start at 10 o'clock.
And
we go until 2 p.m.
Okay. So that's your window of opportunity, folks. 10 to 2 at all those locations that you just heard there. And, a lot of convenient places for people who, very strategic.
We try to make it as easy as possible.
So you said you were a pharmacist. Any words of wisdom as far as people paying attention to their health and their medication? I know sometimes people get the medication, but they're not disciplined enough to keep up with it sometimes.
Yes. Your health is very important, period. You can't work productively, you can't take care of your family, you can't enjoy life if your health is compromised. This is an opportunity for you to be on the path of wellness. Whether you are already on it or not, this is an opportunity to know your health status. We see patients coming into the pharmacy who are unaware that, they have certain diseases and all of a sudden they have to be taking all these medications. The shock of it all can reduce how compliant they are with their medications. But the earlier you jump on it, you have better control. You may not need to be on so many medications. We are also going to be there. We can recommend better treatment options for you, more cost-saving options for you as well. So there are several opportunities you have through this health screen to speak to all the medical professionals that will be there.
All right. Well, there you have it, folks. You can head out to all those locations that you heard there, all conveniently located, and see what your basic state of health is. And I'm sure a lot of people will be there before 10 o'clock, you say. They'll be waiting for you, right? Well, we've been talking to Steve Tibbetts, president of Rotary Central, and Jamila Badu, the health project chairperson with Rotary Central. And on behalf of everyone, thank you all for the great work that you do. This kind of thing, what can you say? That it's a great service that you're providing to the community.
Well, thank you very much. We're doing what we can. Health and wellness is well and truly on our radar year after year, and we're just happy to be able to give back to the community. So come and see us.
Thanks for coming in.
Thank you.
Yeah. Thank you. It's 1 o'clock. Let's check in with the newsroom.
This is the People's Radio Station. Radio Cayman in the Cayman Islands. From Radio Cayman's newsroom, this is Headlines. Local, regional, international news.
The Headline News is brought to you by Kirk Market and Health Services Authority.
With your latest headlines, I'm Elizabeth Charles. A high-stakes murder trial is now underway. Jevi Ebanks reports.
The murder trial of Demisio Frederick is now open to the jury in Grand Court. The jury are currently hearing the opening speech of Deputy Director of Public Prosecutions Barnaby Jameson, KC. He's outlining his case as to why he says Demisio Frederick is responsible for the December 2024 murder of Christopher Johnson. At the heart of the dispute seems to be value of property or other valuables that led to an altercation. The Deputy Director of Public Prosecution says the case is a prime example of hatred and passion, saying hatred is a poisoned river that runs throughout this case. The court is now on a break for a 15-minute adjournment, after which Mr. Jameson is set to continue his opening statement. Reporting from the courthouse for Radio Cayman News, I'm Jevi Ebanks.
We'll keep you informed as the trial progresses. In international news, Wall Street is sliding as a widening Middle East conflict rattles oil markets and stokes new inflation worries. The S&P 500 is at its lowest level in more than 2 months, with selling across all major sectors and small caps down more than 2.5%. Investors are bracing for fallout from the war as Tehran's threat to ships in the Strait of Hormuz and production halts by regional oil and gas producers drive up global shipping costs and push crude and natural gas higher. The same shocks hammering Wall Street are raising an uncomfortable question, according to Reuters. That is, what protects your portfolio when war, not economics, is driving markets? A Reuters column notes that bonds and stocks have started moving together since the pandemic, undercutting the classic 60-40 mix that once cushioned investors in sell-offs. An IMF blog warned that this fading diversification leaves investors, including pension funds and insurers, exposed to bigger losses and potential systematic stress. Some experts say portfolios will need broader diversification into areas like commodities and private markets. But recent swings in gold and other precious metals and even private credit show there is no clear new safe haven yet. Those are the latest headlines. I'm Elizabeth Charles.
Radio Cayman. More news available at www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
Looking for fresh, healthy food that's full of flavor? Then you've got to visit Kirk Market. Our dishes are made with fresh, high-quality ingredients. Enjoy vibrant mixed greens or satisfying pasta salads. Or try one of our delicious grill options like blackened chicken, spicy beef steak, or grilled salmon. Looking for something light and flavorful? We've got sushi rolls and poke bowls prepared daily. And don't forget to explore a hot bar or Billy Fresh salad at the salad bar. Stop by Kirk Market today for breakfast, lunch, or dinner and taste the difference. Eat well, live well with Kirk Market.
At HSA, we strive to provide the highest standard of care with compassion, integrity, and dedication. And so we say thank you, Cayman, for continuing to make us the most awarded organization on island by voting us the best of Cayman Islands in 9 medical categories. Your support reminds us why we do what we do, to serve the Cayman community with kindness and excellence. To find out more about our award-winning services, visit hsa.ky. At HSA, we are committed to caring for you.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
The coconut industry on the Sister Islands boomed between 1890 to 1915, with annual exports exceeding 1 million per year. In 1906, the industry peaked with the Sister Islands, accounting for the entire export of the Cayman Islands. A coconut disease had previously killed off all of the trees in Grand Cayman. The industry was so successful that the government of the day went as far as to impose a special export duty. However, on Friday the 13th, 1915, a hurricane of unprecedented severity devastated the island of Cayman Brac, rendering most homeless and decimated 98% of the coconut trees on the Brac and 40% of those on Little Cayman. To add insult to injury, the coconut disease that struck Grand Cayman would soon arrive in the Sister Islands. During the 1920s and 1930s, efforts were made to revive the coconut industry, but the efforts were modest and the industry failed to reach its previous level of prosperity.
Information from this historical vignette was sourced from Founded Upon the Seas, A History of the Cayman Islands and Their People by Michael Creighton and the New History Committee.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Hello, Cayman. This is George. From April 1976, I've been tuned in, listening in, and calling in to Radio Cayman from the first time, the initial broadcast, and continue up until today. So I want to congratulate Radio Cayman and the whole entire staff.
Hold on a little bit longer.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back, and a quick look at the weather here. 83 degrees here in Georgetown. It feels like 91 outside. Wind out of the east-northeast at almost 15 knots, and today's forecast calls for partly cloudy skies the rest of the afternoon and straight into tonight, and the wind will be at 10 to 15 knots east to southeast, and seas moderate, running at 3 to 5 feet. And look at the radar. We got some little spots of scattered showers in the Cayman area, and the same over out at the Sister Islands. And turning now to our guest in the studio, the Ministry of Health wants to know your opinion about the service you get at HSA facilities, and a survey was launched yesterday. Joining me to discuss the survey and its aims are the Honorable Catherine Ebanks-Wilkes, Minister of Health, Environment and Sustainability, and also in the studio is Acting Chief Officer Exie Tomlinson-Panton and Senior Policy Advisor Alanis Linwood-Amor. Ladies, good afternoon. Welcome.
Good afternoon, sir. Thanks for having us.
Now, it seems like you're really out to make some changes here at HSA. What made you decide to take this to the public?
Okay, great. Well, Mr. Glidden, I'm really grateful again that you have welcomed me into your studio. The ladies
Always
here.
A pleasure to have you.
I would just like to take a minute to greet those who are listening this afternoon. I'm just saying good afternoon. And also I would like to introduce, I think this is the first time that I've had Acting Chief Officer Exie Panton on radio with me. I'm sure it won't be the last.
No.
Miss Exie. And also Miss Alanis Linwood. How do you say it? Amor,
yeah.
isn't that beautiful? Our senior policy advisor, who is also working in the health unit. And, we're here today to just share with the public. Some of you, many of the public may have taken the time to tune in to the press conference where I talked about the diagnostic assessment that was being conducted on HSA. And we're here today primarily to just share with the public where we're at with that exercise. And we're at the place now where we're looking for public feedback. And after all that introduction, I totally forgot what you asked.
Why you decided to take it to the public rather than just what KPMG is doing?
Okay, that's a good question. Well, I think the important thing is no one knows better than those individuals who have benefited from the services of HSA. And since being a minister, I've seen a few individuals have reached out, sharing positive experiences, and there have been a few that have reached out, sharing their concerns. And so this assessment that's being done by KPMG is data-driven, and we want to ensure that the public has their opportunity to express their feedback on how they feel the Health Services Authority is doing. And so that's the reason why we have ensured that HSA, the assessment isn't just an exercise where KPMG is taking a few random surveys and doing their internal reviews, but also giving the public an opportunity to share their concerns.
I like what it's called, by the way, diagnostic, very medical kind of
thing. Yeah, I was
just
thinking, going to the doctor.
So how do people go about doing that? I'm not sure who wants to take that. But.
Well, so we've done 2 surveys, but the survey that is out for the public is for patient and caregivers. It can be found at gov.ky/MHES. And we've done a lot where you can locate them at all the district centers, HSA district centers, and also the waiting room hospitals. Their TV screens would have a graphic with a QR code. So we made it very accessible that it's just a matter of taking out your phone, taking a picture of the QR code, and you can access the survey on your phone.
That's for the high-tech people.
For the high-tech people. However, for those that want to do written results, written surveys, we've also have physical copies that will be distributed to all of the health centers, health clinics in Grand Cayman and also the Sister Islands. We're looking at Faith Hospital as well, and the Little Cayman Clinic as well.
Now, how extensive? I started to take a look at it online because you can't go forward unless you fill out something. Right?
Yes, that's true.
So, but how personal does this get as far as information on the person?
So the first part of the survey asks questions about the respondent, but those are very general questions. The first question is about your age, and the second personal question would be about your gender. And then it goes on to, it has various sections. So section 2 would be about your relationship and experience with the HSA. And the very first question, I should point out, asks you to complete your relationship in terms of if you're completing it on behalf of somebody else. So if you're a caregiver or if you're a parent for somebody underage. So that's actually the very first question. So then you have your age and gender questions. And then the second part is your relationship and experience with HSA. The third section speaks about just assessing the respondent's awareness and understanding of HSA's governance and direction. And then we also assess communication and engagement. And section 5 would be the patient's voice and influence in decision making. And then we also ask questions on trust, accountability, and responsiveness. And then overall reflections, and we have some opportunities for you to complete more open-ended questions to give us recommendations on improvement. So those are generally the questions that you would see in the survey, and it would take about 15 minutes to complete.
So people don't have to really worry about getting into their personal medical situation while you were at the hospital and that sort of thing, right?
So essentially what we're evaluating, what KPMG is evaluating on our behalf is the governance frameworks and the organizational processes and operational effectiveness. That is what the diagnostic assessment is about. It is what we're trying to gain from this is evidence-based insights and having KPMG highlight any gaps, and then we're hoping for practical recommendations for improvement. So I think some media has come out calling it an audit, and that brings to mind, things from a financial perspective. It's not that. It's just as I said, governance frameworks, that's what we're evaluating, operational effectiveness and processes. That's what we're looking at for the overall diagnostic assessment.
So KPMG will take the data from this survey and analyze it and incorporate it into their report as to where there needs to be improvement, where you could be doing this instead of the usual way it's done.
Right.
Yeah.
Yes, and I think that goes in line with sort of the view that I wanted to take with taking on the role, is to really start with looking at the foundation on how the governance model has been working, how the ministry is working with the board, how the board is working with the authority, and again, looking at the senior management team and how they're ensuring that the hospital is delivering on its operational and financial performance. So I think one of the things that I am proud of, and I'm looking forward to just having this as a benchmark, is just being able to see where we're at, and where we move forward, and having some, direct recommendations on how we can move forward, And I think responsible governance really means reviewing systems regularly, and strong institutions are built through continuous assessment and improvement. So I think this is something that we will all, look back on this exercise later and say, well, it was good that was done, because that was where we then saw, you were able to mark and say that we have moved forward. The thing is there is a lot of work going on at HSA as well, right? We have a hospital that I talk about it just about every opportunity I get. The staff at HSA are working really hard because the hospital is at maximum capacity almost every single day. And so I don't want this to come across like we're doing this assessment to find fault. We're doing this assessment to see how we can improve, how we can partner and make their burden lighter and easier, so that the people of the country, they're able to benefit and have, efficient, fast access to healthcare, which I think that's one of the constant sort of messages that I've been hearing as minister. I think people just really want to be able to have access,
right?
So you're looking to find out where you're doing well as where
correct.
Sure.
you
Yes.
need improvement.
That's exactly the case. Not just looking at what is deficient and what we need to improve on, but what we're doing well. And we know that there are areas that the Health Services Authority does well. And again, we were speaking about it just the other day with CEO Lizette. The one thing we don't do enough of is share what we're doing well. Training of Caymanians. I know recently HSA received an award from the Chamber of Commerce for doing well with ensuring that Caymanians are being trained in healthcare. And that's one of the areas that we're working on from a ministry level, ensuring that we are creating training pathways for Caymanians in medicine.
A lot of people, I don't know if a lot, but certainly there are some that's going to look at this cynically and say it's another survey. It's going to go on the shelf and nothing is done. What do any of you say to people who might be thinking that way?
Well, I'd like to chime in and just say that I spoke to that when I did the the
press
briefing, right? Press briefing, with sharing with the public that what's going to make this different is that I've given a commitment to coming back to the public with the findings and the recommendations on what we need to do. I want to say, if any, which I'm imagining that there will be recommendations on what we need to do moving forward. And so that's what I feel will make it different. In addition to that, what we are going to do is we're going to ensure that there is an implementation plan, because a lot of times there's a lot of policies, strategies, reports, and there's some have recommendations, some have implementation plans, and I feel that what is critical to the success of this assessment is bringing it back to the public so that there is accountability to me as well, and also rolling out an implementation plan so that we can measure our progress and know what we need to do in order to accomplish what has been identified in this assessment.
Is staff at HSA going to be taking the survey also?
Absolutely, yes. So we've done 2 surveys, and the staff survey is more involved. It's involving more of their experiences, their communication within internal structures. But we're also offering the opportunity for external providers, stakeholders, such as vendors, government entities that work with HSA to provide their feedback as well. So it's 2 different surveys, but all of the information will be collated in a summary form for the Honorable Minister to present to the public.
So the staff will give you a picture from the inside.
Inside, sure. Yes.
And I guess a lot of the operational, day-to-day operations of HSA
yes.
would be addressed there.
Yes.
So when people, you can pick up hard copies or do it online. For those who are picking up hard copies, how do they return it back?
So we've worked with, I'll also want to give kudos to the Public Works Department. They've provided some, it's like box forms, structures where you can just submit your survey. So it's completely confidential. And I do want to make another point that it is anonymous. So the responses that will be provided will be in a summary form. So there's no identifiable factors. So once a person completes it, fills it in, puts it in the box, we would then collect it and give those results to KPMG. If you are completing it via QR code or on our ministry website, that information just goes immediately to them. And once we get the results, then all of that would be summarized.
Once all the data is in, how are you anticipating as far as any time period before we see some kind of result from this and action being taken?
That's a good question. I mean, immediately after we receive the report with the recommendations, the ministry team will, I will bring it to the public, and then we will work towards an implementation plan, and that will also be shared with the public on what they can expect and when they can, setting clear timelines again for persons to really appreciate and measure what we're doing. Mm-hmm. So I think that is certainly what will set this whole exercise apart, is that we do intend to share with the public step by step. That's why we're here today. We could have just issued a press release saying that, we're seeking public feedback, but we want to continue to keep the public engaged, and I want to share with you. And the one thing that I will ask Alanis to just elaborate on is with the drop boxes. Can you just also just say again, I think you might have mentioned earlier, but can you say again where the drop boxes will be located?
Right. So they're located at all the district centers, HSA district centers from West Bay to East End. We'll also be having it in Cayman Brac at Faith Hospital and Little Cayman Clinic. So it's a white box, and there'll be a signage, so it's not, hopefully it won't be too difficult to miss. We do want to thank HSA's communication team, because they are also helping us a lot with basically relaying this information. So we'll work with the nurses and the staff there, and they would be also advocating for the survey to be completed.
We do have a caller, so I don't know if you could put on your headphones there. Good afternoon, you're on the air with Talk Today.
Yes, good afternoon, Shadow. I'd like to speak to Catherine, please.
The minister, you mean? She's listening.
Yes, sir. I'm here.
Mrs. Ebanks. I am Robert Ebanks from West Bay.
Yes, sir.
And, you know, I feel so good when I hear your voice on the radio. Because out of your family, you're the only one I haven't met as yet. Hopefully, it will happen sometime. But I want to let you know, as a patient at HSA since 2022, I was diagnosed with a heart problem. And I found the staff very nice to me. At times, they showed me things that I had to do, and I didn't want to do them. But to find out later that, you know, sometimes what you don't want to do, that's what you have to do. And I'm glad today that I've taken the advice from those people. Catherine, we have a communication problem at the hospital. That's the only complaint I have about HSA. Besides, I personally would love to see a nice blowed up photograph of Anthony S. Eden in the entrance of that hospital, because not everybody knows who this man is. But if we put a photo there, we could more or less help the public to see at least who he was. Because he's one of my greatest political friends in my lifetime. So, Mrs. Ebanks, it's good to hear your voice, and I look forward to someday talk to you one-on-one. God bless you on your journey.
Thank you very much, Mr. Robert, and I want to thank you for your kind words, and I will continue to wish you good health. And one of the things that I want to thank you for is your feedback that you've provided publicly. Again, like we just said earlier, you know, not every experience that people have with HSA is negative. But what I will ask of you is if you could please participate in the survey and share your feedback there, because that's where it's going to be properly collated, and KPMG will be then providing that assessment to me so that I can move it forward, move the changes forward in terms of, like you mentioned, communication. So maybe that is something that other people feel we need to work on. And we certainly aren't going to take the approach where we feel that we're getting it all right. We know that there are areas that we need to work on. But rather than assuming and thinking that, at least certainly for me as minister, I'm not going to sit and say, oh, well, I think that HSA has a communication problem. For me, this is where the feedback from the patients is so critical. So thank you for your phone call, for calling in. And I too would like to meet you. So I hope that we can meet soon. And I really appreciate the recommendation about the picture of the Honorable Anthony Eden, having it feels like just recently taken on the role of Minister of Health. It's crazy to believe that we're already approaching almost 1 year. But being the Minister of Health that accomplished as much as Mr. Eden did, he certainly does deserve to have a picture placed somewhere out in the atrium. And I'm sure that we will have a discussion with CEO Lizette and the board, and that's something that can be worked on.
Well, thank you so much for the call.
Yes.
You take care. So let's go over again about how people can participate in this and where they can find the information.
Absolutely. So you can access the survey at gov.ky/MHES. There's a link to the survey. There are also, if you stop at any of the HSA district health centers, the main hospital, their waiting rooms, it would be circulated on their TV. There's a QR code which it can be accessed through your phone. There's also physical copies of the surveys that will be circulated to these district centers, including Faith Hospital and the Little Cayman Clinic. And there would be a drop-off box where you can fill it by paper and drop it in the box. As well as if there's any questions, we do have an email. It's mhessurvey@gov.ky. One of the staff members would be more than happy to send you a link directly as well. And just a reminder that the survey closes Monday the 16th of March. It's open for 2 weeks, and we will make sure to keep promoting the survey so we can get as much feedback as possible.
Okay, actually, we have some 2 calls on the line here, so let's get those in. Good afternoon. You're on the air. Hello, are you there?
Good afternoon, Inspector Cello.
Good afternoon, Glidden.
Good afternoon, Minister Catherine, and is that Alana?
Alanis.
Alanis, okay.
And
XC. Good afternoon, sir.
Good afternoon.
Good afternoon. I was reading in the Compass yesterday about sort of the proposed changes to who the government pays for in terms of being medically indigent. I'm a little confused, maybe I'm perturbed, why we're giving that role to the chief medical officer, the CMO, for that person to determine whether or not the person has sufficient financial resources to pay. I don't know if it's the wording of my understanding, but it seems as though the CMO is now being asked to be more of a financial analyst as opposed to a medical professional.
No, sir. No, I was just waiting for you to finish. That's not the case. So if you look at the proposed definition, now I don't have it in front of me, but there's 2 different parts. One is a recipient of DFA. So that individual would be deemed medically indigent, and they would go through the typical financial assessment process. So that has nothing to do with the CMO. The second position is an individual who has a medical need, who may not necessarily, it may not be where they are a recipient of the Department of Financial Assistance.
I understand what you're saying. I'm not sure if that's what is being conveyed in the proposed amendment, because saying that the CMO, that the person is unable to pay due to inadequate financial resources. Maybe because, my suggestion would be that maybe it could be that, okay, the person is unable to pay because of a medical condition.
Right. So it says the person is a recipient of like I said, I don't have it right in front of me, but the person is a recipient of DFA, which is that they are financially unable to pay, or they have a medical condition. The process is still going to be where it goes through the assessment process through the DFA. So that would be done through and that is how we have discussed doing it initially, which I will elaborate more when I debate the bill tomorrow. But I will still take on what you're saying, and when we go back to the ministry, we will look again at the recommendations that we have put forward to make sure that there isn't something. We're all human, so we'll take a look at what you have suggested, but the intent and the works that we've done is that the person is either they are a client, or they are a recipient, of DFA, or they have a medical condition.
But Minister, I would again strongly recommend that you look at that, because I do not think, maybe I'm the only one. Sometimes I am an outlier.
No, sir.
Unless it's the way that it was reported.
I'll take on your recommendation.
Maybe
it could be.
That's the confusion there.
Mm-hmm. Are you looking at the draft bill, sir, or you were just reading an article?
I was just reading the article in the Cayman Compass.
Well, I mean, I read an article this morning as well that says that you're taking the decision and placing it all in the minister's hands, which Minister of Health. But the current legislation has it where the Minister of Social Development makes a decision on the advice of the Department of Children and Family Services. So all we're doing is it's sort of a lateral move where it's going from one ministry that doesn't necessarily deal with the medical services to the ministry that's relating to medical services and getting the advice from the clinicians.
Okay, ma'am. I thank you, and I would just again recommend that or suggest that you look at the legislation as well as what's being reported. And maybe the Compass needs to revise their report.
Yes, sir. Well, I will look at like I said, when we go back to the ministry, we will double check. Sometimes, reports are made from different, news outlets, and we can't really control that. I mean, when we go down to Parliament tomorrow, I will be debating the bill in its form. And if it is that there needs to be committee stage amendments, which often happens because someone might raise a concern or a suggestion, and I've already received a phone call today that there will be, someone bringing a committee stage amendment. That's what makes our, electorate or the participation. Losing my words here now.
That's a parliamentary procedure.
Yeah,
right?
And it's the beautiful thing about living in a democracy. Just like how I want you to know, I appreciate you calling. Because like I said, we're not perfect, and it could be that it's something, maybe just one word. So we'll have a look at it, but we did take the time, and I want to give a shout out to the Legislative Drafting Department because they're usually very thorough, and they've been working so hard, and they're turning things around so quickly for us. So just wanted... But thank you very much, sir.
All right. Thank you so much for the call. We're going to be right back after this break.
Accidents and illnesses can strike without warning. Ouch! When it comes to urgent care, every second counts. At Doctors Hospital, we have a dedicated team of experienced doctors and nursing staff available to you 24 hours a day, 7 days a week. Don't waste time in an overcrowded emergency room when you need urgent care. Whether it's a broken bone, a severe infection, or a sudden illness, trust in Doctors Hospital's unwavering dedication to providing the best immediate care. For complete urgent care when you need it the most, choose Doctors Hospital, located in Georgetown, 16 Middle Road.
Explore your history. Explore your land. Explore your sister islands, the ultimate staycation experience. Your culture, your freedom, the land that time forgot isn't gone. It's your sister islands.
Discover all that our sister islands have to offer.
On Angie, how does it feel to have broken the bull riding world record?
Sore, Sean. That bull was angry.
Angie, I think that bull is headed towards your red convertible.
I broke the world record and he broke my car. Oh well, at least I've got CG Comprehensive Motor to cover this.
Get covered for collision, damage, and more. CG Brit-K. Good like that. All benefits are subject to policy provisions, including eligibility at the time of service.
What if your child's future could take them anywhere in the world?
Discover global opportunities at Dorman Day Winter Fair. Meet top boarding schools and summer programs from Canada, the US, and the UK, all in one place.
Explore advanced STEM programs, humanities, fine and performing arts alongside elite-level sports, basketball, baseball, soccer, ice hockey, and more.
Meet admissions experts, ask questions, compare courses and campus life. Plan their global journey with confidence.
Saturday, March 7th at the Westin Ballroom from 1 to 5 p.m.
Register now at dormanday.ky.
Happy 50th anniversary, Radio Cayman. My name is Carl Brown. You're the spirit and the ethos of the Caymanian people. Lomax Rankin in the mornings. Cheryl Ann and Joy Brandon reading news. Dorian Miller, the first talk show host. Sportscaster Ed Bush. What a memory. Radio Cayman is more than the voice. It is the soul of the Cayman Islands.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back. We're going to go straight to the phones. We have a caller waiting. Good afternoon. You're on the air.
Good afternoon to you, Mr. Charlo.
Hi.
How you doing?
All right, and you?
Not bad. Good afternoon to the minister and to her team in there.
Good afternoon, sir.
I hope you all are well.
We're doing great. I'm doing great. I can't speak for the other ladies. I know they've been busy.
Doing fine, thanks.
Well, they all sound really well, so that's good. That's half the battle, I believe. I called to compliment, but then I know I heard the first two callers or some callers before me, and I just wanted to chime real quickly on those. For clarity, I only just saw a brief snippet of an article just before I came on, about a half an hour before I came on, where it was talking about the switch that the last caller was talking to you with, or talking with you, Minister. If I understood your response really quickly, it's that you are essentially the clinicians, the doctors in the clinics, etc., that fill out those DFA forms. They essentially deem somebody, if unless that has changed, they essentially deem the person in their professional opinion to not be able to work. And if I get you right, the decision then from a legal perspective is technically just being signed off by the CMO. Would that kind of be right? Or does the CMO get involved with actually making the decisions even after the clinician in the districts decide it?
So the process is that the CMO would be looking at the information provided to us in terms of whatever the medical situation is. And tomorrow, I mean, if we had time, I would give you a couple of live examples, but I'll be doing that tomorrow to share with the public so that everyone can understand the reason why we're making this change. And to just share with you quickly, a lot of it has to do with just making the process a bit faster, especially when you're dealing with a medical condition. So it's really to put it back into the place of the clinicians, the doctors. They liaise constantly with the chief medical officer, and it would then be, so it's not the Minister of Health is just making a decision that someone is medically indigent. It's based on the information that is provided from the practitioner, and that's actually the information that's being assessed for persons who need medical assistance. That's still being done, but it's actually through a whole slew of checks. So again, it's not taking the responsibility from one ministry and putting it in the hands of me, the Minister of Health, for me to determine. There's still a process, and it's going to be based on the evidence that's provided. But the importance is that it's being done to ensure that when the situation is a matter of life and death, we can make a decision very quickly.
I have no doubt that that's what you all are seeking to do from an efficiency standpoint, Minister. And even if it was placed in a minister's hand, I mean, it is what it is, and sometimes the public can't see that behind-the-scenes process and how those things are complicated. So looking forward to hearing you on that. I just really wanted to, and thank you too, by the way, I just really wanted to, if there was any feedback rather than complaint I would give in regards to the HSA. There's actually two of them. One, I don't know when was the last time and I gave this feedback many times over, when the hospital will call you or email you. I know they used to do calls. I haven't received it too much recently because I also take care of getting meds from my mother. Mm-hmm. They'll call you to ask on these a survey, some feedback on your visit.
Right, the automatic surveys.
That's right, and I've given it over and over, and it's never changed. But so it's worthwhile just sharing now. In the West Bay process, I don't know when the last time you may have gone there, but it happens across all the certainly in Georgetown as well. The process for the way that you necessarily collect medicines and pay for them, and then also the confidentiality. I've always been struck, I believe, by by how very little sort of confidential space that you have in collecting medicines. Like the dividers, there's nothing there. You're basically sharing with everybody that's behind you meds that you're taking and things that you're dealing with. And there's even the recent fit out on the Smith Road thing, as good as that is, it still doesn't provide that sort of confidential interaction with the patient and the person there dispensing their medications, and especially too when you're sharing on behalf of other people as well. And so that's something that I really would like for our HSA to address in terms of providing that sort of privacy. I don't know whether it's a little enclosed area or something. And then the other one is that process for actually collecting it in the West Bay clinic. It is much more pronounced. So I don't know if you know this.
Oh, yeah, I know.
Yeah, you will go and you will want to, let me see how they do it now. You go to the little pharmacy window to tell them you're there to, say, collect medicines. And then they'll give you a little piece of paper, and then you need to go back to the window. And then after that, the line might have been real long. There got to be a way where you can pay for it or approach and get it all done seamlessly in one particular go. They make you go out and come back, and sometimes you can do it twice, just based on the way that, because you need to go get it stamped and then come back. That's what it is. The process seems to be a little bit disjointed, and if you've ever been in the West Bay Clinic, I think of all the seniors and stuff that go in there, and you constantly got to go back and forth a couple of times. Maybe there's a way of carving out a little space within that same little pharmacy area where they can just do the collections there or something, and you don't have to go back to the main window. Just some feedback, man, because I've given it often and for a very long time, and it just doesn't change. Thanks, Minister.
Well,
You're all doing a great job. Thank you.
Thank you, too.
Thank
and
you.
I want to just say quickly that, again, the same thing that I said to the previous caller. Thank you for your public feedback. But where I really need it is I would ask of you, please just go on and do the survey, whether it's online. I mean, it's on the government hub.
It's on our website, gov.ky/MHES. But if you want a direct link, I would suggest you email mhessurvey@gov.ky. We'll also have an automated response with the survey link as well. So we're going to try to get it out as much as possible.
I'm going to make sure to get it to you. But one of the things that I want to say as well, and this is good news, is that you're right, especially with a district clinic like West Bay and Bordentown are the busiest clinics in the different districts, right? Of course, Georgetown, what's it called again? The
Smith Road Center.
Not the pharmacy though. Non-emergent care, but I can't remember the name of the clinic right off the bat. Long and short of it is the clinics outside of Georgetown, West Bay and Bordentown have high volume. And you're right, the pharmacy area in West Bay is very small. And we don't really have the room right now to offer privacy, which is so important when you're dealing with health matters. So the good news is that what is on the list of infrastructure improvements is we are planning to expand the pharmacy at West Bay Clinic so that there is more confidentiality and, importantly, the medication, the proper storage of medication. Not saying that it's not properly stored, but because the volume is so large, it makes it challenging, to constantly keep inventory and so forth. Now, the point that you made about the efficiency, I think that would also feed in well with the survey, because you're right. I've seen the process. You go, you get a ticket, you got to go back to the front door. So you're right. That's certainly something that we can improve on. So thank you for your feedback, and please, and I'm speaking to all of those who have experience going to the clinics, whether in Bordentown or Glidden, please moment out the survey. This is the way that we can see the areas that we're doing well and other areas where we can improve on them. So thank you very much to the caller.
Well, we have to wrap this up because the minister is late for caucus meeting.
Late for caucus.
Minister, thank you so much for coming into and talking about this. Also, Exie Tomlinson Panton, Acting Chief Officer, and the Senior Policy Advisor, Alanis Linwood Amor. Thank you for being here to expand and tell everyone about this survey. And I hope you get a great response.
Thank you very much, Mr. Glidden. Thanks for having us today.
Thank you very much.
Have a great afternoon.
Thank you. You too.
We're going to take a break. We'll be right back.
Did you know that Doctors Hospital provides urgent care services 24 hours a day, 7 days a week? And Doctors Hospital's urgent care physicians have access to the most advanced MRI and CT imaging in the Caribbean, providing reliable diagnostics when you need it most. When you need quality urgent care for an illness or injury, Doctors Hospital is here for you 24/7. Whether it's a migraine, chest or abdominal pain, shortness of breath, broken bones, or another urgent need, Doctors Hospital at the top of Walker's Road. Urgent care right now.
Saturday, April 18th, will be the gathering of the future. The gathering of budding scientists, budding botanists, budding engineers, budding medical specialists, marine biologists, systems architects, and much, much more. The Rotary Central Dr. Bill Rudy Science Fair will be at the Arc Commander Bay, 8 a.m. to 12 noon. The gathering of the future. Students from over 15 schools across Cayman. Save the date, April 18th. The Rotary Central Dr. Bill Rudy Science Fair, sponsored by CUC, supported by the Cayman Motor Federation. Sign up today. RotaryScienceFair.ky. The future is sparking.
The Consumer Price Index Rental Survey conducted by the Economics and Statistics Office is now underway. The survey aims to collect data from residents of the Cayman Islands who are renting properties. The ESO invites participation in the Consumer Price Index Housing Rental Survey, which the ESO will conduct in February, May, August, and November each year. The CPI survey helps to calculate the inflation rate or the changes in the cost of living in the Cayman Islands. Trained ESO staff with ESO ID cards will administer the survey. The individual information is confidential in accordance with the Statistics Act. No individual data will be published or disclosed. Survey data are exempt from Freedom of Information requests. For more details, please call the ESO hotline at 516-3329 or directly at 244-4602.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back, and the phone lines are open. We can talk about just about anything that you have on your mind. The number is 1-800-534-8255. That is courtesy of Flo. Also 949-8037, 949-6990. And WhatsApp, of course, 925-3261. And I hope people take advantage of voicing their opinion, in this survey. And actually, this is the first such public survey, and widespread for HSA. So, we often will hear someone grumbling about this or that at HSA, and this is an opportunity to get your feedback in directly and, try and make a contribution to improving things at HSA, because the minister seems very serious about, trying to find out what the picture is as from the patient's outlook. And, we're talking about health services. The patient's opinion is very, very important. And it seems, this is not one survey that you're going to collect a lot of information. Then it sits there. She's promised to come back to the public with what the findings are. And, they're not just looking for, what's wrong. They're looking for what they're doing right, too. So that's where, patients can give their feedback of the good things that happen when they go to a HSA facility, whether it's the hospital or to the district clinics. And we heard some people call in here and give their suggestions. But this is the first time that such a survey is being done. So take advantage of it. If you're not an online person, you can pick up hard copies, paper. You can pick up a paper copy from your district clinic and return it. So you only got 2 weeks to get that done. And interestingly enough, I found that they're doing a separate survey for staff at HSA. So they're not just looking from the patient's perspective, but they're taking a look behind the scenes. And it'll be interesting to see the results. I assume they're going to also make that known. Excuse me. What the staff is saying, because that's another very important aspect. Is what the morale of the staff is, what staff see as working well, and where there may be hitches along the operational procedure that could be done better, or that it's something that you need to continue to do, or even increase the effort of a particular thing that is good. But it does seem like the minister is quite serious about taking this and making for a better health service. And, you got to take your hat off to her for that, right? Because when it comes to health and access to health, that is something that any government must have at the top of mind. Having top-rate facilities is one thing, but that people actually have access to it is a very important aspect of the healthcare that is, in any community. Because, as you may or may not know, the Anthony Eden Hospital, as it is now known, and I guess it'll be a while before that name catches on. People still refer to the Georgetown Hospital. But if someone shows up there and needs medical care, that hospital, the government hospital, is charged with providing them with medical aid. They can't just tell you, oh, you don't have insurance? Well, sorry, we can't admit you. Regardless of your financial position, if you need emergency care right then, you're going to get it. And even if it's not emergency, but the care is urgent, you are going to get it. And it's not every place that you go that, you have that opportunity. Of course, people like to know, people for the most part, want to be able to pay their way. There are those who would rather not and get it free. And but Georgetown, Anthony Eden Hospital, is there to provide health service for anyone in need, regardless of, their insurance status or financial status. right there you can get help. And we have a caller on the line. Do we have a caller? Yeah, let's see if we can. Let's put him on. Good afternoon. You're on the air.
Hey, good afternoon, Mr. Glidden. How are you doing?
I'm fine, and you?
Good. Just a couple of points about the HSA's services and survey. Are you working with them? Are they monitoring your feedback, or this is just talking into
No,
the
she just took those notes when she was here. We're not taking anything and passing it on. We need people to go do the survey. As she was saying, that's where the impact is going to be made, because that data is going to be put in to the whole analysis.
Well, I figured out how to write myself, but they should know as well that Cayman Public has a major hesitation at putting things in writing, especially concerns and complaints. So they will get, I wish they did verbal, or even maybe a round of community meetings, and possibly even take account of comments on shows like yours. But anyway, I'll throw my 2 points out just for what it's worth. And those are what I see as needs are.
Can you hold on for me?
Okay.
Can you just be patient and hold on?
Sure.
Let's go to the news, and I'll come to you when we come back from the news.
Sure.
If they are talking about us,
living in your head rent-free all this time,
we must be relevant. Radio Cayman since 1976. From Radio Cayman's newsroom, this is Headlines.
The Headline News is brought to you by Kirk Market.
With your latest headlines, I'm Elizabeth Charles. Online registration is now open for the 2026 Deputy Governor's 5K Challenge, the last one to be held under Deputy Governor Franz Manderson's leadership before he retires in July. The three-race series runs March 8th on Cayman Brac, March 15th on Little Cayman, and March 20th right here on Grand Cayman, with adults paying $25 and children $10 to take part, all in support of local charities, including the Special Olympics Cayman Islands, Jasmine, and the Breast Cancer Foundation. In international news, President Donald Trump has turned a White House appearance with German Chancellor Friedrich Merz into his strongest public attack yet on key allies over the Iran war. Trump tells reporters he believed Iran was, quote, going to attack first after nuclear talks failed, and says U.S.-Israeli strikes have wiped out Iran's Navy, Air Force, and air detention, declaring, quote, just about everything's been knocked out, end quote. He lashes out at the United Kingdom and Spain as, quote, very uncooperative for initially refusing use of their bases, mocks UK Prime Minister Keir Starmer with the line, quote, this is not Winston Churchill that we're dealing with, end quote, and vows to, quote, cut off all trade with Spain. In other news, Yoichi Ito is stepping away from a major Japanese government tech project after renewed scrutiny of his past ties to convicted sex offender Jeffrey Epstein. In a post on his website Tuesday, Ito says he will not seek reappointment when his term on the Global Startup Campus initiative ends this month, following new U.S. Justice Department files detailing his relationship with Epstein and reports that universities were distancing themselves from the government-backed $400 million program. Those are the latest headlines. I'm Elizabeth Charles.
www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
Looking for fresh, healthy food that's full of flavor? Then you've got to visit Kirk Market. Our dishes are made with fresh, high-quality ingredients. Enjoy vibrant mixed greens or satisfying pasta salads. Or try one of our delicious grill options like blackened chicken, spicy beef steak, or grilled salmon. Looking for something light and flavorful? We've got sushi rolls and poke bowls prepared daily. And don't forget to explore a hot bar or Billy Fresh salad at the salad bar. Stop by Kirk Market today for breakfast, lunch, or dinner and taste the difference. Eat well, live well with Kirk Market.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Let's take a quick look at the weather. 82 degrees here in Georgetown. It feels like 87. Wind at about 14 knots coming out of the east-northeast, and it's partly cloudy skies for the rest of the afternoon and into the night with east to northeast winds at 10 to 15 knots with higher gusts. Seas, moderate. Seas are running at 3 to 5 feet. And we have a caller that's been patiently waiting for us to come back to him, so let's go straight to the phones. Are you still there?
Yes, sir.
Yes. So you're about to make 2 points.
Right. Might be 10 by now, but...
Okay, you're making a list.
No, a lot of them are related, and I call it maybe under the category of tracking or administrative type things, although it's more tracking. For instance, if a person has any type of disease, illness that is medium to long term, there's a need for tracking for ensure that medication is being taken, for ensure that to ensure that follow-ups are done, referrals are done. It could be any aspect, physical, any aspect of health, but there's very little assistance or process, or there's very little formal process to help people track. For instance, years ago, I created a chart myself, several charts to give to a clinic to ask if they want to use them to help the clients track blood pressure, weight loss, sugar, insulin, different things that, it's very simple these days. That was before AI. AI can do it in a minute. Create charts to track and also add appointments, add, follow-ups. And also there's a huge need for that because you can't, especially with older people, and a lot of people are alone now, their kids are working. You need to give them some extra help. And there's also an app that the hospital has created. I think any patient that checks in, the first thing the hospital should do is check and confirm that that person has that app on their phone, and if they don't, just help them to set it up. It's a one-time setup, and it's free. So that alone, those two things alone would help immensely, I think. But that tracking I mentioned also especially relates to overseas care, because I've had to help people that have to go overseas, and that, of course, is a 10 times more complicated situation. You have to know doctors, medicines. You have to know what to take with you, when to go, where you're going to stay. I mean, there's 100 different things and nuances that you have to be on top of, because if you miss one of those things will have the doctor say, sorry, we can't help you. You got to go back home and get your stuff and then come back when you're ready. And all of that, of course, ties in with what the minister is doing now. If you were applying for medical assistance, all those things are related. Sometimes you even have to have, I don't know the extent of her program, but some things for aid, you have to have even your land documents, of course, your passport, your visa. There's so many things, but it's like very random, like you just got to go figure it out like a jigsaw puzzle. But I think if there was an app or a tracking system that was shared by the hospital and the patient, then everyone could pretty much be on the same page. And especially so, although it's not as dramatic, is the daily taking of medications and whatever treatments you're supposed to be following. Exercise regimes, all those things.
You're talking about making sure you know that you took it, right? Or that you can mark. Because, I mean, sometimes you come to the end of the day and say, or you're going to bed and you say, did I take the meds?
Right. And, of course, a lot of people have helpers. The thing with the labels I've seen on bottles, the prescription bottles, most of the labels don't say what the medicine is for. So I've had to help people pick up 6-8 bottles of thing, and it says what the medicine is, the medicinal name, but it doesn't say this one is to relax your muscles, or this one is to balance your cholesterol, or whatever it is. So just a simple word or two on the labels. And the other thing also, a lot of the labels are small. Why I have to help someone sometimes, because the person can't read it. It's too small. So if they're looking at 6 or 8 bottles, they're going to either make a mistake possibly, or just get frustrated and just don't bother to take them.
Yeah, why do you think it's important that you put what the medicine is for?
Exactly. If it's for headache or migraine, put migraine on it. Don't just say, the name of the medicine and take 2 a day. The person should know, I think, at a glance what that medicine is for. And as soon as I pick up medicine at the pharmacy for anyone or myself, I write on it right away, what's this medicine for? And the last point is, a lot of people have helpers. Many of them are great helpers at home, but some of them aren't as literate as they should be.
Mm-hmm.
And that again is another thing that I've not heard anybody sort of address. But a lot of these things are,
even though they might be a helper or even a caregiver,
right?
They may not be able to read,
right?
Which, especially when somebody's on 4 meds,
right?
Knowing which one is which,
right? And of course, if the family checks at the end of the day or the end of the week, they'll say, "Oh yeah, he's taking the medicine every day," because they're not going to say, "I'm mixed up, I'm confused." There's so many medical names that are similar, even that, and some pills you got to split them in half, and there's so many complications. The UK does have very good programs of community nursing and assistance where people go around once a week or whatever is needed and check on the critical patients especially. So like a home visit thing. So those are things that are needed, but I think a lot of it could be solved almost administratively by guides or tracking systems to help people. So I'll leave it at that. I mean, I've had good service from the HSA over the years. I've also had times when they mix medication between 2 complete strangers. And thankfully, one of the 2 caught it and was able to correct it. I don't know if they ever followed up with the other person. But there are things that happen that are just a bit more care and time and not rushing, on the HSA side.
So, are you planning on taking the survey?
Yes, I do. I do plan to take it. Yes, I haven't taken it yet, obviously, but all feedback is good. But I just think that alone, as the primary indicator, is not the best, because not many people are gonna. Caymanians don't like to put things on paper. They don't like writing. They'll talk for an hour about HSA, but they're not going to take a 2-minute survey on.
So wait, is that from a confidentiality?
It's a traditional thing. It's a cultural thing. It's a thing of the separation between the powers and the man on the street. It's a perceived thing, is what I'm trying to say. And some of it could be intimidation. Not everyone is, again, that literate that they'll feel comfortable putting down into a few lines what their views are. They might say, "Well, you messed me up last month when I came to check on it," but they're not going to go into they're not going to hit the specific detail that you need sometimes. So, oral or focus groups, those types of things could be done also. Maybe they're doing those as well. I don't know.
All right. Well, thank you for calling.
Thank you, sir. Have a good afternoon.
You too. We have another caller on the line. Good afternoon. You're on the air.
Yeah, hello.
Yes.
That's what the brother was talking about, the medications, man. You can easily get mixed up with them,
Oh, yeah.
Because I'm taking a few tablets a day right now, and it don't tell you on the bottle what the tablets are for. And the last time I seen my doctor was about going in 2 weeks ago, and I discussed this same problem with her,
Mm-hmm.
So when I do the survey, I guess I'll have to make that be a complaint as well.
So you think if you have what the medicine is actually for, instead of just the name, that would help in you taking the right medicine at the right time?
Yeah, because it's easy to make a mistake with it, man. When you're taking maybe all 7, 8 tablets at a time. You understand? It's easy to make a mistake with it. So if you have it on the bottle, it's much easier for you, you know?
Yeah, I can see what you mean.
Yeah, so, I mean, I not reached that stage yet that I need a helper. But who knows? I may live that long. Yeah, man, because that can be kind of tricky too, you know, with the helpers, them and things like that.
Oh, yeah.
Yeah, man.
You're trusting that they're going to get it right.
Yeah. Anyway, Chado, like I said, I'm not familiar with this online business.
Well, remember, you don't have to rely on the online, to do this survey.
No, I contacted HSA in Smith Road.
Yeah.
And they told me that I can just write it as a letter, you know.
Yeah, and also you can go to the district clinic and you can get this survey.
Yeah. Okay. Anyway, later, my brethren.
All right, you take care. Have a good afternoon.
Yeah, man, you too.
What's up? Question here. Are hard copies available at district clinics or only the drop boxes? No. The hard copies can be picked up at all the district clinics, and you can return them after you've completed the survey. You return them at the district clinic because they will have the drop boxes there. So if that's your preferred way of participating in the survey, just go to a district clinic, or if the hospital is more convenient, you can get it there. But district clinics, they all have the survey. You can pick it up, fill it out, and take it back to the district clinic where there's a drop box that'll have a sign on it where you can just go up to it and drop it off. We have to take a little break here, so stay with us. We'll be right back.
Accidents and illnesses can strike without warning. Ouch! When it comes to urgent care, every second counts. At Doctors Hospital, we have a dedicated team of experienced doctors and nursing staff available to you 24 hours a day, 7 days a week. Don't waste time in an overcrowded emergency room when you need urgent care. Whether it's a broken bone, a severe infection, or a sudden illness, trust in Doctors Hospital's unwavering dedication to providing the best immediate care. For complete urgent care when you need it the most, choose Doctors Hospital, located in Georgetown, 16 Middle Road.
Freedom, Cayman Brack. Freedom, Little Cayman. Soft breezes, blue waters, no traffic. Unwind and rejuvenate your mind, body, and soul. Sister Island Staycations, a taste of freedom. Discover all that our sister islands have to offer.
Hi, I'm Tommy from TCE Paint Shop, a longtime listener and customer of Radio Cayman. I have treasured memories of distinct voices of former members of staff of Radio Cayman, which include Ken Smith, Doran Miller, Lomax Rankin, Joyanne Rollins, Tessa Bodden, Alton Ebines, Edith Bush, Paulette Connolly, Norma McField, and the voice of Radio Cayman, Mr. Loxley Banks. Happy anniversary, Radio Cayman, and thank you for 50 years of service to our island.
You are a child of the universe.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Welcome back, and we do have a caller on the line. Good afternoon. You're on the air with Talk Today. Hello, are you there?
Good afternoon, sir.
Yes, good
Sir,
afternoon.
Good afternoon.
Hi.
How are you?
I'm fine. How are you doing?
I'm pretty good. Mr. Glidden, you know, we say that our police officers are not doing their jobs in the island. But when you got officers on the road trying to pick up speeders and people are flashing, giving a signal that police is up at the top of the road.
Yeah.
Now, how can the police officer do their job in our department if we are out here interfering in their jobs? You know, the police department need to send out a warning to people in regards to doing these flashing, making us know that cops are on the road. If we get picked up, we know we're breaking the law, we're breaking the law. Why are you giving somebody like to make them know there's someone up front? You might just come back one day and forget it yourself and end up getting a ticket. And here you are saving 10 cars in the stretch that you're driving. You know what I mean?
Yeah, it's like
it's crazy.
You know, that person, he's or she is a speeder. It's like all us speeders have to, take care of each other.
Yes, and it's all like 3 and 4 cars just flashing you while you coming up and they're going down, making you know that the police up there, And it's not fair. They needs to leave and let the police do their job. We give them enough bad credit as it is. Let's let them do the jobs. But some road stops on our roads randomly with lights and cars do having a lights. Some got one light, one headlight, one park light. Some ain't got no brakes light, no park light. We got too many cars on the road, and I can't understand how often these guys get their car inspected. You haven't. From last year, I've been seeing all these cars coming up every morning with one light, going on with one light. It's coming up, going down. It's crazy. And you're thinking that it's a bike or something. When you get up on it, it's a car.
Mm-hmm.
It's a car, and we need some on the road on a regular basis. Just stops cars randomly. Don't give a shit who you hold up behind. Pull them on the side of the road and make sure that they got license, insurance, and all the lights is working.
Well, in the case
because
of the lights,
too many on the road.
You can see that, right? And pull them over. Fix the light.
Give them a temporary warning.
Yeah.
5 days to put this light, and you're gonna come to the station and make us see that you put that light in. You come to the wall, stay on the road next 5 days again, and your light has not been fixed. Then you give them a hefty fine. But Mr. Glidden, we are farming and garbage and all those things on the island, right?
Mm-hmm.
And the primary schools, and I think the high school do it too. They do a little bit of farming, right? So I was at a primary school this weekend, and they have a little bit of farming on the grounds there. But the fact of the matter is, Mr. Glidden, it's not being taken care of. It's not being taken care of.
Oh.
Out up at the old John Gray High School, they got all these grow boxes out there that's growing just wild stuff in it.
Well, you got weeds?
So, yes. They're not being used for the purpose that they're there for.
Yeah, I thought that was like a school project or something that,
Exactly. And, I was surprised when I was at this primary school over the weekend and see that they had a little bit of farming going on there, but it's not being maintained. It's out of control. When we can talk about we need to teach our children this and our children that and blah, blah, blah. And you started in the schools for manners' sake and for project-wise and everything-wise, and it's not being maintained, the children lose interest. They're not going to go home and try to plant a tomato seed to see if it's going to grow. Because they don't have no...
Hello?
Yeah. Can you hear me?
Yeah, I can hear you now.
You didn't hear me before. You didn't hear nothing.
Yeah, I heard you say that they won't go home and try and grow a tomato plant.
Yes, exactly. And it's crazy, to start something in the school for these children is not being continued as the grades, the classes just keep coming and going because, every August you got new kids coming into school from primary to high school, and then another couple of months you got high school going out, and you know what I mean? But it hurts to see that they're doing something and it's not being maintained. I just thought that I would talk about it because we always talking about backyard farming and blah, 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 blah. And we start at school and we never finishes it. And the kids have gone home and start their little farm in their backyard. Well, we never know that,
Yeah,
and I just want to say...
That's disappointing to hear because, we've heard a number of times about these projects in the primary schools especially that, children are introduced to backyard farming. And to hear it is just kind of left to deteriorate there, that's not good news at all.
And you know what? I'm going to say this, but I really don't care. You know, went into the bathroom with my family member, little child at the primary school, and the door says out of order, and the toilet seat is broken in half, and that is still unlatched for kids are still going in there. You know, that door should be locked until that seat is repaired completely. The seat is broken half, Mr. Glidden. You know, when somebody tell me what I see, I'm like, what the heck is this doing? And especially in a primary section school, a broken seat, but yet the door stay out of order, but the door is open. Those kids can go in and get cut on that seat.
Yeah.
They're not gonna be thinking half the time, well, you know, I can probably still use it. You know, kids are kids until they grow up and know better. You know what I mean? But I just think that primary school need to be looked in more and a little bit more upgrading where it's necessary and all of that kind of good stuff. But Mr. Glidden, I'm gonna let you go, but I need to tell you something. Over the weekend, I remember. I'm like, whoa! I remember when I was working downtown in Kirk Freeport. I had a lady there from India. Her husband was from India, and he was working at one of the hotels on Westview Road. So he was a waiter, and he came and said that he was serving. You know, asked him if he had any children, and he said, you know, my wife, I have a little newborn boy, and he said, congratulations, so nice. So when the table was overnight, the guests, the customers gave him $100 as a gift for the newborn baby, his first and only son at that present time. Say, you know, this is for your baby from us. And, you know, he thanked him and could not believe it. So he went now and told the rest of the staff there what had just happened at the table. And do you know that they told him that he could not keep that $100. It had to go in and share it up amongst whoever was working that night.
Oh.
Do you know when they start putting this gratuity on you? Do you know what year that happened? Because I'm talking about the 90s right now. I'm talking about the 90s when this actually happened.
It almost seems like it's always been there since the home days of came out.
Oh. I don't know, but something has to be. Those hotels need to be looked into to see they're really doing their housekeeping. Their work, you know. But anyhow,
but I think someone else called. Did you tell me something similar the other day, or was it another call?
Yes. I was telling you the lady you know was do the housekeeping at one of the hotels.
Right, and they leave it in the room.
She was told they're not to remove any tip that is being left in the rooms. They'll go and pick it up.
So this seems like it's a policy that's kind of all over then, or at least we know what this is. This is a different place, right?
Yeah, this was the restaurant now that I would just read the story on, but now this is a hotel doing housekeeping. A room for 4 days. That tipping, it belongs to you automatically, and it belongs to Mary, Jack, and Harry.
But I mean, that was a direct tip to that waiter or waitress, and you know, I don't see why they would have to share it.
$100, the $100 was a direct tip to the waiter.
Yeah.
For his newborn baby. Yes.
And that person earned that because of the way they treated the customer. You know, if they hadn't done a great job, baby or no baby, that those customers weren't going to give him $100 just to give it because he had a baby. If he had to have been doing a very good job.
Yeah, and a congratulations of you know his first baby boy and all that kind of stuff. You know what American people are when they come to children, get all excited and forget to eat their dessert. Oh my God! Anyhow, later but greater.
All right, you take care. Have a good afternoon.
Bye-bye.
Yeah, that doesn't sound like the right thing to do if you're, running a restaurant way. You should a wait staff who has treated their guests, very well. Because face it, if you're a bad waiter or waitress, even if you just had a child, somebody isn't just going to pull out $100 and give to you, because you have a baby. You had to have, established a good relationship with the customer, and they had to like you. They had to really like you as a person for them to do that, and that's what being a waiter or waitress, somebody in the hospitality industry, that's what you do. You have that personal relationship there, and because you're doing something, directly with these people. Well, time's running out here for talk today, and I want to thank all of you for tuning in and listening, and to all the callers for joining in and making some conversation here. And remember, fill out that survey. Let HSA know what they're doing right, what they're doing wrong. I'm Charles Glidden. One love.
Talk Today is brought to you by the Ministry of District Administration. Explore your history. Explore your land. Explore your sister islands. And Doctors Hospital. Peace of mind is important when life happens. Doctors Hospital. Always there for you. Call 949-6066.